Study designs are broadly classified into observational and interventional studies. Observational studies are further classified into descriptive and analytical studies. Analytical studies. Many researchers are interested in identifying the cause of diseases. However, many diseases do not have a single cause. Multiple factors contribute to the development of these diseases, otherwise known as multifactorial causation. Such factors contributing to the development of diseases can be considered exposures, and the diseases themselves can be considered outcomes. Analytical studies are conducted to examine the association between exposures and outcomes. Such analytical studies include cross sectional analytical studies, case control studies, and cohort studies. In cross sectional analytical studies, the researchers recruit a study sample from the target population. Then, information regarding exposure and outcome is obtained at the same time point. As the name suggests, no follow up evaluation is done for the purpose of the study. They conduct statistical tests to check for an association between the exposure and the outcome. In case control studies, the researchers recruit a group of participants with the outcome. They are called cases. Then they recruit another group of participants without the outcome. They are called controls. The researchers evaluate and compare the exposure status between the cases and the controls. In cohort studies, the researchers recruit a group of participants with certain common characteristics. This group is called a cohort. They evaluate for the presence of exposure in this cohort at baseline. Some members of the cohort have the exposed group, and others do not have the exposure, otherwise known as non exposed group. The cohort is then followed up over time. Some participants in the exposed group develop the outcome while others do not. Similarly, some participants in the non exposed group develop the outcome while others do not. The proportions of participants who develop the outcome in the exposed and non exposed groups are then compared. Examples of analytical studies include examining the association between smoking and lung cancer, family history and schizophrenia, systemic hypertension and erectile disorder, vitamin deficiency, and acne vulgaris. Consider a study in which a group of researchers wanted to examine the association between intelligence quotient and academic performance in medical college students. They recruited medical college students and evaluated them at a single time point. They evaluated their IQ using a standard tool, and at the same time, they obtained the students' marks from the college records as a measure of academic performance. Then they checked for the association between IQ and exam marks using statistical tests. This is an observational study as the researchers simply collected the necessary data and did not provide any intervention for the purpose of the study. Since the exposure and the outcome were measured at the same time, it is a cross sectional study, and since the association between exposure and outcome was evaluated, this is considered an analytical study. The study design was described as a cross sectional analytical study. Consider another study in which a group of researchers wanted to examine whether positive family history was a risk factor for the development of breast cancer. They recruited women with breast cancer as cases and women without breast cancer as controls. Then they evaluated the family history of breast cancer in first degree relatives of both cases and controls. During analysis, they compared the proportion of cases with positive family history with the proportion of controls with a positive family history. This is an observational study as the researchers simply collected the necessary data and did not provide any intervention for the purpose of the study. Since the participants with the outcome, that is, women with breast cancer, and participants without the outcome, that is, women without breast cancer, were recruited and compared for exposure status, that is, positive family history, the study was described as a case control study. Finally, consider another study in which a group of researchers wanted to examine the association between gestational diabetes mellitus and premature delivery. They recruited a sample of pregnant women from the antenatal clinic of a teaching hospital. This formed the study cohort. Some of these women had gestational diabetes mellitus and formed the exposed group. The remaining did not have gestational diabetes mellitus and formed the non exposed group. They followed them till delivery and observed which group had a higher incidence of premature delivery. This was an observational study as the researchers simply collected the necessary data and did not provide any intervention for the purpose of the study. They recruit the study cohort based on a shared characteristic, measured the exposure, that is gestational diabetes mellitus at baseline, and followed them over a period of time to document the development of the outcome, that is premature delivery. The study was described as a cohort study. Thank you.